Welcome to Life Esteem, a program committed to delivering information that's important to you and your community.
Hello, welcome again to Life Esteem. Always great to have you as a viewer. Hey, today we're going to talk to a dynamic lady by the name of Tina Nixon. Oh, I think you know who she is. Tina Nixon is the Vice President of Missions Effectiveness and Chief Diversity Officer for Pinnacle Health. However, I think most of the community remembers Tina as being the longtime CEO of the YWCA of Greater Harrisburg. Welcome to the show.
Thank you for having me.
Yes, we do. So we're seeing you in a whole new role.
Yes.
Right?
Yes.
And so tell us about Pinnacle Health and how long you've been there.
I've been there since May 5th, and it's a new role for me. It's exciting, looking at our community through a different lens, really being able to connect individuals to their healthcare needs is something that is important, and I'm really excited to be in this role and really have a broader impact on the community. The YWCA is a wonderful organization. I will always believe in the mission. But this opportunity allows me to have a broader impact. So I'm really excited to be in this role.
Fantastic, fantastic. And the title, Mission Effectiveness. Tell us about that.
So everyone asks, what does that really mean? Yeah. Well, it really means looking at the mission of Pinnacle Health and making sure that there are program services, resources in the community to help us, really implement our mission and really help those who have access or barriers to accessing healthcare, and really looking at the community as a whole to make sure the needs are being met as it relates to healthcare and the different chronic diseases that impact our community. So,
and as Chief Diversity Officer, what is some of your vision, some of the things that you'd like to see take happen? Occur?
So the Chief Diversity Officer position is exciting to me from my past work at the YWCA. It's really looking at making sure those who are of different backgrounds, different cultures, understanding what their healthcare needs are. So this position will allow me to do training, to interact with different cultures, to look at how our community is transitioning and individuals coming in from different places, and really, internally in Pinnacle Health, really making sure that the healthcare providers understand and have the tools they need so that they're able to provide quality services to individuals that come through our doors.
And we do have quite a number of large, individuals coming in, immigrants from different countries now. And that's really important as they come into utilizing your services and really understanding their culture and the language. Have you seen specific groups that we have identified that are truly coming in? Isn't it a lot of folks from Nepali? And
yes. So we noticed we have our Siricom, which is our translation language services that we use. We track that, and we noticed that there's a large percentage of Nepali coming into the community. And one of the requests out of that was to have additional training on their culture and how we can provide better services and what are some of the barriers or language barriers. And so we, Catholic Charities and someone from the Nepali Bhutanese community came in and provided a training for some of the staff and nurses that directly work with the population. So that was interesting, and I think it was very educational and a good resource. As we move forward, we've been asked to do trainings on the Somali culture and the Muslim culture, and because we have a large Hispanic Latino population, we'll be looking at the different individuals that make up that entire culture. So there's a lot to be done. Everything's our community is always changing. I know with things that are happening in Syria, the United States agreed to bring over, a couple 100,000 Syrians, and so looking at how we can just better provide service and understanding the different cultures that come into our community. So it's exciting work. I'm really excited to be doing this work. So
it is. I'm telling you, and you're coming in at the right time, because looks like Pinnacle Health is just expanding every day. I mean, they really have branched out in central Pennsylvania. How large are they? How many facilities are there, by the way?
So under Pinnacle Health, we have 3 facilities. We have the new West Shore Hospital,
Right.
which if you haven't been there, please go see it. It's absolutely beautiful. And then we have the Harrisburg Hospital, and then we have Community General Osteopathic, and we're a partnership with Hershey Medical Center with Pennsylvania Psychiatric Institute, which is a collaboration, but we also have some programs up at a polyclinic hospital.
Right.
So our footprint is getting larger, and as it continues to grow and we continue to look at our community needs, again, through our community health needs assessment, we are able to address some of the issues that impact the broader community. And I always say within the footprint of Pinnacle Health, which is growing.
Yeah.
Now, I know one of the things that you were able to do when you were at the YWCA was bring in a lot of things around racial, justice. And one of the programs you did was Let's Talk a Conversation on Race.
Yes.
And you're going to do something similar at at Pinnacle, is having some staff go through that.
One of the things that, as a healthcare provider, a healthcare system, one of the commitments is to providing the training and understanding diversity and inclusion. And I thought, Let's Talk a Conversation about Race is a great opportunity for those individuals to really have a deeper dialogue, in addition to the training, a deeper dialogue around that and a deeper understanding. So we'll be collaborating to do that, which I'm very excited about. And, at first when you think people aren't going to sign up, and now I have way more people than I thought I would have. So we'll be doing several series. Pinnacle Health has a diversity champion and a diversity leadership certificate that they give individuals that go above and beyond the regular trainings. When you're onboarding, you do have diversity training, diversity 101, cultural competency trainings, and those type of things. But the diversity championship and the diversity leader certificates are for individuals that go above and beyond understanding our culture and diversity and inclusion and how it impacts the work that we do. So Let's Talk a Conversation about Race is going to be one of the activities that individuals can participate in to add to their list of diversity, leadership, and champion initiatives that they're doing. So I'm really excited about it. I'm really happy to be able to bring it to Pinnacle Health. So.
It's a wonderful process. I know Pat and I both have, been able to facilitate it and participate in it as well, and it's a great process.
Yeah,
one of the things that I also found a great process and really want to thank you for is the training that your volunteer chaplains receive, and we, along with myself and Paul Derrickson, who is the wonderful head of spiritual care at Hershey Medical Center for years. I mean, Paul, retired from there, and he and I have teamed up through Life Esteem Ministries to, to provide this training. And it's really been a blast. I have to tell you, you have some great people coming through that program, and it really adds, I think, to the overall quality of spiritual care there at Pinnacle. I don't know if you want to comment on that at all.
And one of the things, and I've just done in talking to our pastoral care department, I question them, why isn't everybody going through this? Because that, I think, the training is beneficial, and it really, for those who are interested in volunteering, it really allows them to see the interaction and make a commitment to, the community to help, with that. Spiritual care, because I really feel, and Pat and I have a lot of conversations about this, it's just not about providing the medical, it's the spiritual, emotional, it's a mental thing, it's all those things combined that really is going to allow us to be a healthy community. So the variety of initiatives that I'm working on right now is really looking at the spiritual component, the mental health component, and the medical component, and the overall healthy lifestyle. So I really feel that this role enables me to bring people together and connect people, because there are phenomenal things being done in our community, and it's just, people need to know about it, and people need to know that you're doing something great and someone else is. Let's bring it all together. I think we would have a much broader impact. So I feel that that's one of my charges in this role, to really bring people together, to facilitate the collective impact that the United Way always talks about, and the
Absolutely.
collaboration that we all so
Yep.
desperately need, especially, you know, in the times when we know our traditional funding sources are shrinking. You know, why not come together and utilize the resources we have to benefit the broader community?
Absolutely. I think it's critical that Pinnacle would take that role because, you know, you don't go to the hospital until you need the hospital, right? And so you think, but once you go to the hospital and you see how much is going on there and how lives are truly impacted. Working as a chaplain in the hospital myself, you know, it's like, wow, this is like a whole different world here. I mean, because everybody's there. I mean, everybody.
That's right.
All, you know, racial and cultural barriers go out the window when you're in time of crisis and need, right? I mean, that stuff isn't coming. So it is so important, though. But then people do bring their unique stories and journeys there, and that's when you come in as critical. You know, you're really considering what do people really need? What are they bringing to the table? And so I think to have a staff that is well versed in diversity, and also to understand community, and then have a community that understands that Pinnacle's more than just an emergency room.
Exactly.
It's a full, you know, life spectrum. It's great stuff.
And really understand, you know, the commitment that Pinnacle Health has in the community, and, you know, how much they give. I was blown away, you know, just starting to realize, you know, over $17 million comes back, you know, to the community from, you know, the work that Pinnacle Health does, you know, and, you know, what we are doing in our school districts and working with our energy pack programs, where we're providing students that wouldn't have meals on weekends with a backpack, you know, for meals, so that they're able to eat. We're right now in the process of doing the health screenings at all the school districts in Harrisburg and up in Perry County, where I think over 800 students have gone through the process, and we probably have a couple more hundred students to go. And we're doing vision screening, you know, weight, hearing, you know, and dental. So it's really about looking at the needs and the health needs of the community, and really trying to see where we fit in, so that we are effective with our mission.
Well, you know, one of the things too, I know we talked about, is really looking at it, as you shared earlier. It's not just the physical, health piece of it, but the whole holistic approach, and that we can keep people well. And that they're not coming into a lot of these illnesses and other, you know, diseases that they may contract. It's because they feel confident and comfortable in themselves, mentally, emotionally. Then they're going to take care of themselves, and they're going to not have some of the concerns that, in a lot of instances, take them to the emergency room.
Right.
And it's interesting about the emergency room. I just read something lately. A lot of people use emergency rooms as their doctors.
Absolutely. And that's one of the things that we're charged with, you know, under mission effectiveness, is to really those people that don't have primary care physicians, that don't have health insurance. We have a team that will come and help you enroll and help you find out, you know, what type of insurance you can enroll in. So I'm really excited to be a part of that team, who really go in and try to assess where individuals are, and so that people aren't using the emergency room as their primary care physician. And I think that's something that needs to get out in the community. There are people that are available to help you enroll in insurance, so that you can find a primary care physician and you don't use the emergency room, you know, as your primary care physician, because it's very costly. You know, every time it's very costly, because you have teams of people working, where if you know, make an appointment and go to your primary care physician, you know, some of those things are covered. And prevention, and making sure you're doing your wellness visits. You know, when you talk about holistic health and you talk about those things, you know, it's just making sure that individuals understand that the resources are out there. You just have to go to them. So
how does Pinnacle interface with entities like, let's say, Hamilton Health Center, or now they have these places where you can just drop in immediately. What do you call it?
One patient. What call patient care? Or
patient care facilities and all that.
Hamilton Health and Pinnacle Health work very closely together. I mean, because we're in the community, we share some of the same patients. I know our nurse navigators that will, for the high utilizers of the emergency room, who may be patients of Pinnacle Health, I think are, you know, between the collaboration we have with Hamilton Health. We are able to sit down and really map out the additional services individuals may need, because I was just talking about this the other day, you know, it's not just the physical health needs that individuals, people come to us with a variety of different issues, and it's not just, the hospital is not going to be able to cure everything. It's other social services that are in place that may be able to provide the support. So, you know, understanding the community is key, and understanding, you know, the resources that are available, you know, in the community. Because if you think about it, we do have a lot of resources available for individuals, but it's just connecting all the dots and streamlining the process sometimes what needs to be done. So.
And that's so true. And there's so many different, you know, coalitions. People always say we need to come together, but every time I turn around, it looks like this is coming together somewhere, right? And so you ask yourself a question: how are we making that collective impact you mentioned, in the most effective way? You know, so it's all good. So the new facility over in Enola. Is that where it is? The new facility, your new hospital? Oh,
the West Shore Hospital.
Is that called the West Shore Hospital?
Yes,
okay.
I think it's Mechanicsburg. It's right off of 81.
Yeah. So, is there something different about? Do they have a specialty, I guess, in that particular hospital, or do all the hospitals pretty much operate the same way, or do some operate? You know, if you have heart issues, you might go to Harrisburg.
So, emergency 911. You know, you go to the closest hospital. But however. I know the West Shore Hospital, they do not do maternity, you know, that's done at Harrisburg Hospital. As far as other illness, you know, other chronic illnesses, you know, they take care of those things like any other hospital. Again, each hospital is unique in its different in its populations, but I think overall providing services. If someone needs to go back and forth, we're able to transport them to receive the care that they need.
Because I noticed that I think I'm right about this. That what is it called? Polyclinic is now more of a. Is it more mental health these days? And
yes,
stuff like
because that's Pennsylvania Psychiatric Institute, and so that's more of the mental health collaboration between Hershey Medical Center and Pinnacle Health.
Okay, so fantastic. Okay.
You know, when I first moved to the Harrisburg area, Polyclinic was probably the first hospital that I was probably introduced to. Then, of course, I knew about Harrisburg Hospital. But when they merged and became Pinnacle, I still had this kind of connection to Polyclinic. And Nate likes Harrisburg in regard to the more comfort level and things of that nature. So when people think about a hospital, they probably think about a hospital like Community General, Osteopathic. There's probably a demographic of folks that tend to want to want to go there. So some of that's preference, but some of it's actually what they're being treated for.
Absolutely.
And how that really would look like. Because I know I had a person just recently said she was having 2 surgeries, and one of the surgeries was going to be at Harrisburg. But the other one, she said she was going to be at Osteopathic for recovery. And I said, I wonder what the difference was, but maybe the services were.
It depends on the specialization and where the where the doctors are operating at. And you know, I know there's the cancer centers out at Osteopathic. And then they have Select Medical, the rehab out there. So it's depending on the surgery, the type of rehabilitation that you need, and those type of things. It really depends on the after the surgery, what the needs.
All right, that makes sense.
So let's say I'm an average citizen or professional, whatever, and I say to myself, you know what, I wouldn't mind volunteering in the Pinnacle Health System in some way, shape, or form. What kind of entry points are there for people to get involved?
So we do have a volunteer department where we have over 500 volunteers. You would have to go through, and again, it's on our website, you know, www.pinnaclehealth.org. You can go there and find the volunteer, fill out the application. There's a process you must go through. Now you know what you make sure you have to have all your clearances like you do with any other volunteering that you do, and there's training that's involved, but we welcome volunteers. That helps, you know, it keeps down costs and helps, you know, take care of individuals. So people, there's like filling up water, you know, helping, you know, take people to therapy or, you know, in different parts of the hospital, bringing magazines, like all types of things you can
people can do.
volunteer for. One of the things that I'm excited about that I found out Pinnacle does a volunteer program for youth in the summer.
Oh.
And they volunteer in specific departments of their career interest to learn more about it, to see if they, you know, it's something that they want to do. And that you can go and apply online, and there's a training program that comes with that. It's very stringent that young adults can follow. So there's a variety of career opportunities other than being a doctor, a medical assistant, a nurse, you know, and I'm finding this out being new, you know, there's housekeeping type careers there's mechanical careers, there's life team careers, there's administrative, there's program development, there's education. So, you know, healthcare is what, you know, if you're looking and interested in careers, you should really take a look at it because it runs the gamut.
I just saw something just recently in the newspaper somewhere saying exactly that the highest growing needs, professionally, are going to be in the healthcare field. And people really be looking at the non-traditional type of things that they may have considered, as potential possibility, but it's all kinds of things now. Because when I think about hospitals back in the day, if you were a doctor or a nurse, I didn't know what else you were doing.
Right.
Yeah, I know you have the radiologists, I know you have first and people like that, but there's just an array of things.
Really
You talk about volunteer, one of the things I was going to ask you, I know many years ago, I know I'm dating myself, but I know that I was a volunteer and since the Red Cross as a candy striper. Do they do anything like that anymore?
And I think it's the same. It might be called something different, but it's similar duties as a candy striper. So and I haven't heard that name recently, but I know, and it's probably just called
something different.
Something different.
Yeah, some volunteer for youth. I mean, the young people. That's one of the things that we would do during the summer.
Good stuff. Well, Tina, so let's take a time out from Pinnacle and take a up close and personal and get to know Tina Nixon in person. So where were you born and raised? Were you born and raised here in Harrisburg?
Born and raised in Harrisburg,
yes.
I was born at the Polyclinic Hospital.
Polyclinic,
okay. And you went to school around here, I guess?
Went to grade school up until 7th grade, Harrisburg School District. Then I transitioned to Catholic school and graduated from Bishop McDevitt.
Okay,
on Market Street.
Fantastic. On Market Street.
That Bishop.
The old Bishop McDevitt. Good stuff then. Yeah, a lot of people probably didn't know that. I always think that you came from Philly somewhere.
No.
Came from,
no.
Good old Harrisburg.
Right from Harrisburg.
So that's
now,
even better.
Your grandmother, was very involved in the community.
My grandmother, she worked for the House of Representatives for many, many years. She worked for Speaker of the House. She volunteered up until a few years ago at St. Pat's Cathedral doing breakfast every morning for the homeless individuals down there. My mother actually ran the St. Francis School Soup Kitchen. She actually got it started years ago. So she did that. So
You say Speaker of the House, you were talking about Kay Leroy Irvis? Oh, you got to be kidding me. Is that right? Wow. Say, what's your grandmother's name?
Cleo Faribault.
Oh, isn't that something? Boy, oh boy.
And you have two wonderful twins.
Yes.
Okay, tell us about
Miles and Miranda.
Yes.
Miles and Miranda they graduated this year and they're off to college. So all at once, empty nest. Miranda is going to Holy Cross. She's studying psychology and playing basketball. Wonderful. Miles goes to my alma mater, East Stroudsburg University.
East Stroudsburg.
And he's studying sports marketing management. And so yeah, they're doing very well. I'm lonely, but they're doing good. My husband said, this is what we raised them for. I'm like, okay, right. But can they come home?
Do you call them every week?
No, I try to. I want to call them every day, but I text them motivational messages every morning, and they can either choose to respond or not. And 99% of the time, they don't. But I still try to do it every morning or every other morning. I do want to call them, but I try. My husband said, "Leave them alone.
Leave them alone. Let them fly.
Let them go."
But I knew your father-in-law well, and I did not realize that that was your husband's father. And it was just amazing how I think we were together at an event, and all of you all were there. And he said, "My daughter-in-law." And I said, "What?" And Tina, I said, "I know Tina."
Good stuff.
Yeah.
good
We were in an
stuff.
incubator program
Oh.
many years ago.
Okay,
Yeah.
fantastic.
And he's still doing business, or?
He's retired now. He's
He's
enjoying the golf course, I'm sure.
Oh, is he?
Yes,
Okay.
so he's having a good time.
Good stuff.
Him and his wife are retired. They travel a lot. I think last week they just got back from Paris in England.
Wow.
I saw pictures, on so yeah, they're happily retired,
retired,
traveling, enjoying. As a matter of fact, they're going up this weekend to visit Miss Miranda at Holy Cross.
Oh,
So
yeah, that's beautiful.
so yes, they're loving their grandchildren and having a good time. So.
All right.
Well, Tina, here you are a professional woman. You're vice president of a major corporation, and plus, family person, this and that. How do you do it? How do you juggle it? And what advice would you give to up and coming professionals out there who are trying to make a way?
How you do it one day at a time. Don't sweat the small stuff.
All right.
And really find something that you believe in, and have make it a purpose. I really believe in diversity and inclusion, and I really believe in this community and really wanting to make it a better place to live.
Yeah.
And one of the things that this position is allowing me to do is get to and talk about some of the root causes of things that we don't talk about on a variety of different levels. So it's just finding something that you're passionate about. I'm really passionate about women and children's issues, and I'm so honored that I was selected to be on the Governor's Commission for Women.
Oh, beautiful. Okay.
And we just got sworn in last week, so I'm really, really passionate about moving that initiative forward, as well as all the different projects that I'm working on. The project that we're working on that I'm excited about, and I can't. It will happen.
It's going to happen.
It will happen. So I'm excited about that. So there's a lot going on as it relates to healthcare in our community. So, but I would just say find something that you're passionate about.
That's right.
Yeah.
And just do it.
And just do it. And the one thing I like is that you're from Harrisburg, born and raised here, you stayed in Harrisburg, and you're making a difference. And people always say that doesn't happen. It happens all the time. But, we don't always lift you up. So now we're lifting up Tina Nixon.
Thank you. Thank
the
you.
Vice President for Pinnacle Health. And so this is really great stuff. So if you had any short-term goals, long-term goals, whatever, for your position there at Pinnacle Health as Vice President of Mission Effectiveness and called Chief Diversity Officer, what would it be?
So my short-term goal right now is getting the community health needs assessment implementation plan completed, and that's I'm leaving here to go to a meeting with Hershey, so we can begin that process. Again, getting all the diversity and inclusion trainings up and running, and then working on my community initiative with my youth conference and the holistic project that I'm working on, and working on a couple of project diabetes with Dr. Joshi, who's going around to talk about diabetes. November's Diabetes Awareness Month, so we have that going, and a project with the lung doctors to really look at and make sure that we're catching men of color before they get to stage 3 of lung cancer. So lots of exciting things going on.
Lots of exciting things, yes indeed. Well, I want to thank you, Tina Nixon, for doing all that you do there at Pinnacle Health, and much success and continued success. And no one does anything by themselves. Community, Tina Nixon needs your help, and she needs your help to just know what's going on at Pinnacle Health, and to encourage others to come in and be a part of it. Volunteer if you can. Get involved. Am I right, Tina?
Absolutely.
Let's get involved. So I want to thank you so much for watching Life Esteem, and I'm going to see you next time. We will see you next time here on Life Esteem. Have a blessed day.
Hi there.